Well, welcome everybody to our online program on addiction and recovery from the Sunshine Coast Health Center up here in Powell River, BC. And our topic is this thing I keep running into. It's kind of interesting. And it's the idea that clients in treatment for addiction need to be controlled. They need to be supervised. Need to put locks on all the doors and build bigger fences and take away their cell phones and that sort of idea, right? And this comes probably from, for example, the public media. If you watch a Hollywood movie or even television, you get the impression that people with addictions just can't be trusted, right? They need to be supervised. They couldn't make a good decision to save their life, right? There's an old joke in the field that goes, how do you know an addict is lying? His lips are moving. And not only are all addicts liars, they're all con artists and cheaters and manipulators. And this idea is pretty much everywhere, even in newscasts. Newscasters will talk about this. And in residential treatment centers, a lot of them, this is a very big idea. They'll usually look at it they'll tell their clients, for example, your best thinking got you here. Or you have a committee of idiots in your head. In other words, they give this message to the clients. They can't even trust their own thinking. So, of course, if they can't trust their own thinking, then it would be ridiculous to expect them to make good, healthy decisions for themselves. And then on top of that, they're usually told something along the lines of, well, you've used a lot of drugs and they've mucked up your brain chemistry, so you can't, as one counselor put it, connect the dots. So you just can't even think straight. So therefore, you can't be trusted to make a good decision because your brain's mucked up. And some of them, by the way, even mention things like some kind of personality that people with addictions have. So they actually have this this insider way of being that actually makes them addicts and therefore makes them make bad choices and be in denial and all this other stuff. And it's interesting, even at the Sunshine Coast Health Center, occasionally, not too often, but occasionally we'll get a phone call from some family member who feels obligated to tell us, geez, you got to watch my son there. He's pretty tricky, and I just want to make sure he's not pulling the wool over everyone's eyes. Or even on occasion we get phone calls from a community, and they'll ask us questions. Well, are all the guys, are they always supervised on outings? So this idea that somehow people with addictions need to be supervised, need to be controlled when they're in treatment, it's actually fairly common. So we'll just take this online program and, we'll see how accurate it is, and maybe even look into some of the research. Anyway, for our first episode, one of the very curious things that we've noticed is that not only do a lot of the public and the families believe that really people with addictions can't be trusted or can't be responsible for themselves, but also a lot of the clients actually believe this. Now, not 100% or anything like that, but like a significant number of clients actually believe somehow that they need to be controlled if they're going to go on and live a better life or quit the drugs. Okay. So here are a few things I've written down here, just some comments we've heard over the years, just to give you a sense of this. So one of my favorite comments is, well, I'm quitting smoking, so if I snap at you, that's the reason. Kind of an interesting one. I relapsed because I got into a big argument with my wife. Or I couldn't help myself. Or I need you to call my wife because she doesn't believe anything that I tell her. Or, I'm still angry at my girlfriend because she forced me to come here. Or I paid a lot of money to be here and this guy's ruining my recovery. Or, I'm late for group because my roommate forgot to wake me up. In each of these statements, you can hear that the person doesn't feel he has control over himself, that he needs something outside of himself to, keep him on the straight and narrow path. So not only the public, but also a lot of the clients have been watching all these Hollywood movies and TV shows, and they believe that they have to be controlled in order to go on and get a good life in recovery. Anyway, that's it for this episode, and we'll be back next time with another episode on our topic: do clients in treatment need to be controlled?